Good morning, my YouTube family, and welcome back to a IVF update. I know that the last video you saw was me prepping for IVF. Well, the last video you guys seen was me telling you guys my protocol for my frozen embryo transfer. You guys, we are 2 days away from that. Today is the 14th of January and our transfer is the 16th. So we've been praying super hard. We've been praying, honestly, we've been praying every day. We've been praying since we started this fertility journey on pregnancy. Our church family is praying for us, our own family is praying for us, friends are praying for us, so it's just a lot of praying going on. But like I said, we're 2 days away from our frozen embryo transfer. This is my first frozen embryo transfer, so I'm just going to tell you guys like the medications that I'm on and like the side effects if I had any as of yet. So the first thing that I was on was the estrogen patches, and this is just to help the endometrium prepare for implantation. So the estrogen patches are just transdermal patches that deliver estradiol. It's a form of estrogen directly into your bloodstream. It's commonly used to help with your uterine lining, to help thicken that up, so it could be very helpful for your implantation. So some of the side effects that I think I've experienced, and it could be from the other medications, but so far what I've experienced is little headache. There is a little irritation at the application site because now I'm wearing them for 2 full days and I have to switch them out like every 2 days. So they're on my stomach a lot longer than I was doing it, because I was doing it every other day. But now it's like every 3 days I don't change the patch. So slight headache, skin irritation, and that's really it. Those are the really 2 main symptoms that I had. Now let's talk about the S-Trace, the estradiol vaginal pill. Okay, so we had our ultrasound on the 8th, and off of those numbers, let me pull it up. So from the 8th, my blood test shown that my estradiol total was at 148. Now they wanted it to be at 150 and higher, so off of that number they put me on the vaginal pill, the estrogen pill. My LH was at 4.16 and my progesterone was at 0.16, but I haven't taken my progesterone in oil until like that Sunday, and this was on a Thursday I believe. So because my numbers was like that, they prescribed me another medication, so I did started taking that. So hopefully that improves my estradiol total and my uterine lining will go up, because I think my uterine lining was at a 9 mm, which is really good. Okay, so estradiol plays a very important role in IVF. As we know, it helps to thicken your uterine lining, and which also increases the chance of implantation for the embryo. So far off of this, I haven't had any side effects as far as the pill itself. I haven't had any like side effects from the pill itself, other than when I use the restroom and I wipe, I do see like the blue from the pill itself. I do take that every day at night before bed, and the patches, like I said, I change them out every 2 days. I take 4 patches. I can actually show you guys right now. So those are the patches and what they look like. Now the last thing I am also taking is baby aspirin, but of course I haven't had any symptoms off of that. I take 1 pill daily at 81 mgs, and the third thing I take is, or the fourth thing is, the progesterone in oil. So off of that medication, so a lot of studies show that taking progesterone in oil does increase your chance of implantation or having a baby. Honestly, the statistics show that people who take progesterone is likely to have a live birth. So my camera died, but like I said, was saying that statistics do show that people who take progesterone do have like a 34% higher chance than people who don't take progesterone oil to have a live birth. The only side effects that I have for this medication is butt soreness. Like my butt is tender. Okay, and also trying to find different injection site that isn't so close to when I put it in the day before yesterday. So I am alternating sides. So like I said, I am alternating sides. So if I do my right side today, I'll be doing my left side tomorrow, and then vice versa. So like I said, that's just the only side effect that I have. Other than that, things are going great. I've been trying to keep my feet warm, my body warm, and just staying positive with a positive attitude that this will be successful, and I pray that it is. So the next video you guys will see is me going to our frozen embryo transfer day. We'll talk about the grade, egg, and all of that, and then we'll know the results in 10 days. Well, from today we'll know the results in 12 days if I am pregnant. And that day that I find out, I will be considered 4 weeks exactly that day. So exciting things are happening this month. I hope you guys enjoyed this video, this quick little update. I will talk to you guys very soon for my frozen embryo transfer. Bye.